You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, how small improvements to your smile can make a big difference. It can actually change your life, according to my first guest. With us, we have Indiana's cosmetic dentist, Dr. Pyle. Dr. Pyle, welcome to the program.
Oh, thanks, Randy. Thanks for having me.
So before we get into today's topic, tell me a little bit about your practice. I mean, who's a typical patient and what are the different procedures you do?
Well, we have a really general practice, so we see all sorts of people from small children to aging adults and do a myriad of procedures for patients.
You've been there a long time, right?
23 years.
Didn't you grow up in the town?
I did grow up in Muncie.
Do you work on your high school buddies? And
you know, I've worked on my high school basketball coach and my high school principal and the whole 9 yards. It's fun. And it's really neat. It's made it easy to build a practice because so many people
know you.
Know me, yes.
Because people are afraid of the dentist, right?
They are.
I mean, do you hear that all the time?
We hear it every day.
What do they say to you?
They say, we've had people say, I'd rather have a baby than go to the dentist, which I can't imagine that. But
do they say, no offense, doctor?
No offense, no offense. And yeah. So
what do you say to that, by the way?
Well, we always tell them, we've had lots of people that feel that way. And you're not the first one, so we can get past this. We don't do things like they used to, where they use nitrous oxide and sedatives and so forth, because we feel like our demeanor we don't need to.
Okay, good. Yeah. So pain and things like that are kind of a thing of the past.
I think so.
You think so?
Yeah.
Okay, good. Now I know you brought a lot of photos, and
we did.
And you do a lot of different types of dentistry. Because I mean, you do general like fillings and
we do
metal free. I mean,
right.
Go over some of the things you do.
Well, we do like you say, metal free fillings. So we haven't used metal fillings for years. We're the team dentist for our little university that's close by, Ball State University.
Oh, is that right? That's right.
It's where Dave Letterman went to school.
Okay.
Yeah.
Okay.
So we handle all the mouth guards and sports dentistry for that university, as well as a local high school. We do cosmetic procedures as well as sleep apnea procedures and headache treatments and so forth.
And we're going to have you back on another show to talk about what you're doing for people with sleep apnea, because you say that there's people wearing a CPAP machine, these machines that help them breathe at night, and you get people where they're off of those.
Correct.
Is that right?
Correct. It is right. It is
and that's a big part of your practice?
It's a huge part of our practice.
Okay, a little bit about you, background and training. Okay, so after high school, when did you know you want to be a dentist?
That's funny. Didn't come from a dental family. My father's a firefighter. But I hung out at the dental office a lot because I wasn't a good patient myself. And
you had problems?
I had some issues when I was younger, and my dentist, growing up, he knew I was a pretty good student. He said, well, hey, why don't you check this out? So as early as 8th grade, I went to the dentist and watched him work, and developed a passion for it.
So by the time you were in high school, you felt,
yeah,
I want to be a dentist.
And it made it easy, because when you know what your goal is, you can reach it pretty easy.
So we're talking about how small improvements to the smile can make a big difference. What are the categories then of, I guess, cosmetic dentistry?
Right. I mean, it can be the smallest thing, from just simply whitening your teeth to maybe shaping or contouring some of your teeth, to big cases where we're rebuilding all of your teeth. Okay. And everybody fits into a different area, but it doesn't have to be a big thing to make a big difference.
All right. Now, you've had a lot of training. I mean, I said at the top of the show, Indiana's cosmetic dentist. I mean, you've had, I guess, a lot of training when it comes to kind of the art of dentistry. Can you elaborate on that?
Yes, I have several mentors. Our biggest one being David Hornbrook, who's been on your show before.
That's right, yeah. San Diego guy.
San Diego guy, and who promised me it wouldn't rain in San Diego, but it's raining.
right when you show up.
Yes. He's probably my #1 mentor, but there are several others along the way, Dr. John Nasty and so forth, who have worked hand in hand with me.
Is there that much to it, though, by the way? I say that respectfully. Is there that much to creating a great smile?
That's a great question, because I didn't think there was. If you would have asked me a dozen years ago, in the first 8 to 10 years of my practice, I thought, oh, these guys are just slapping porcelain on teeth and it looks great. Until I really started digging into it, and it's incredibly complex from our end of it.
Okay.
It's pretty easy for the patient, but it's complex for us because
complex to make it look natural.
Yes.
Because I told you I could spot veneers. I'm a connoisseur. I could spot veneers 20 yards away.
Right.
And you say no, not mine.
Not mine.
Okay.
You only spot bad veneers 20 yards away.
Okay.
Yeah. So, But so much goes into it, not just for how we want things to look, but also the function of the veneers or function of whatever we want to do.
What does that mean, the function?
Well, some people say, well, I just don't like this tooth and it's pointy or whatever it might be, and can you just shave that off? Well, maybe we can, but maybe we can't because that would alter their function.
Okay.
So we have to step back a little bit and really go into great detail as to how they function.
Now, you say you're changing people's lives, and,
Right.
and you know, you're a dentist, and of course you think the smile is probably pretty important.
Of course.
How important do you think it is?
Well, and you know, sometimes people say, well, that's not a fair question to ask a dentist
Yeah.
because he spots every tooth walking down the sidewalk. But so do you. You know, when you're walking down the sidewalk, first off, you already told me you can spot veneers from 20 yards away.
Yeah.
But second, you do pick up on that person. You know, when you walk into a crowded room, you pick up on the person who is the center of attention because guess what they're doing? They're smiling.
They're smiling. Good point.
Okay. If they're not smiling, they're probably over in a corner with maybe one or two people just kind of with their head down, and their posture is different, and so forth. But with a great smile,
It's like charisma.
it changes them completely.
Okay. So do you see those transformations? I mean, people that come in and you know, really never smile. You say they cover their...
Oh yeah, sometimes
do you see this out and about?
They smile, or you know, the biggest ones, we'll ask a patient, can you bring me a picture of what you want your smile to look like? And I can't tell you how many times they bring it in and it's not them. It's a picture, I want my smile to look like so-and-so.
Okay.
And I say, well, do you have any of when you were really smiling, or, you know, what your teeth looked like when you were younger? And said, well, I never smiled. And that really hits home because you realize this isn't something that happened over the last 2 or 3 years. This is something that's plagued them for a lifetime. And they haven't smiled in pictures.
In this economy, why invest in your smile? To the adult.
To the adult.
To the successful 35, 30-year-old plus 50, 60.
Yeah. If
Why
you're
do it?
interviewing 2 people,
Okay.
one's smiling and one's not smiling,
Okay.
who are you going to hire?
Yeah. Good point.
Yeah, it's
Because the smile does
if you're
make a
looking,
difference.
yeah, if you're looking at, you know, so much today, as far as computer dating and so forth, if you see a picture of somebody who's kind of glum versus a picture of somebody who's smiling big and they seem confident about themselves, you know, you're going to pursue that person, I would think.
So you brought some photos. What are we looking at there?
I did, Randy. The first photo is one of my assistants. This
She works
is
with
also, yep, she is also my sister.
All
And
right.
she didn't like her smile. She had some function or some biting issues where she would grind her teeth and had some TMJ issues and headaches.
Okay.
And so it was a multifaceted approach, and oh my gosh, we got her from here to here. So with her, what we did was we corrected that bite issue, and she still didn't like her teeth. And she didn't like those flat spots and the chips and so forth, and how they were shaped, and they're a little bell shaped compared to what she wanted. And we mocked it up, and we gave her this beautiful smile when she was finished.
Very nice.
Yeah. Look at the before and look at the after. I mean, look at the difference. She doesn't even smile the same.
It is very nice.
Yes. It turned out beautiful.
It's a pretty smile.
It turned out really nice. When you look at the before and after, she almost looks younger, a more youthful smile. She's definitely more confident in how she smiles. She's smiling so much bigger in the second picture than she is in the first.
She looks healthier, by the way.
Yeah, she does look healthier.
And so those are porcelain veneers.
We did 10 actually across the front, which is more than some people do, but we felt in her case, because of the function or the bite being an issue, we had to extend it on beyond the borders.
Is she flashing her smile to patients all the time saying, hey, this is...
Definitely. And matter of fact, she is really convinced other patients to follow through with treatment because of how we were able to treat her.
Okay, good, good.
Yeah. Let me show you this other case that we have. This is a young college student. I
Okay.
told you we were on the campus of Ball State University. She came in and she didn't like her smile at all. You can see in the befores some of the things that she didn't like. She just had some intrinsic stains that she couldn't get rid of. She'd brush and brush. You know, her teeth were clean. It wasn't like she didn't brush her teeth. It was just her.
What does somebody say? They go on a consult with you. What do they say to you? Like, what does she want, if you can remember?
When she came in, she said she wanted to like her smile, and she didn't like her smile. She had never liked her smile.
Okay.
And so it was, she said there are a lot of pictures where she's, you know, tight-lipped and didn't show her smile very much. And if you look at the before, it almost looks forced. Her smile looks like we made her smile.
Did you have to make her smile?
Come on, smile bigger. We want to get those teeth in there. Yeah. And so we sat down and we went over options. You know, obviously as a college student, her budget wasn't as big as somebody else's might be.
When you see this, by the way, okay, when you're okay, so you're on the consult, you see this. Do you see the end in mind? Do you go, this is going to be good, like in your head?
To a degree, but I try not to jump too far ahead because I don't want to put my thoughts into their minds. You know, I want them to drive it because, quite frankly, she's the one that looks at her teeth every day, all the time when she looks in the mirror, and not me. We see her every 6 months.
Okay.
And I want her to be happy is the #1 thing. So, to a degree, yes, I think, gosh, we could really make these look beautiful, and I want to see her reaction to and what she wants. In her case, this was really a neat case because it was pretty minimal. We only worked on 4 teeth in the front, and we were able to go from here to here. And then I want you to look at her smile when she's done. I mean, she looks confident to be a model. I mean, she really does.
I mean, it does make a big difference on the appearance.
Yeah, and look how relaxed her smile looks in the second picture compared to the first. She doesn't show as much gum tissue when she smiles.
What does she say when it's all done? Because this is a huge transformation here.
It really was. I mean, she's written us all sorts of things on our website. You can check those out as far as compliments and so forth. A neat story was I ran into her mom. I hadn't met her mom, and her mom gave me a big hug and
recognized you and said, "Hey, Doctor."
Yeah, Dr. Pyle, I'm so happy with what you're able to do with her teeth. So it gives her so much self-confidence, and you know exactly what she was looking for. You know, the big thing with her is she's everyday student or everyday gal walking down the street, and there are a lot of people who are not happy with their smile, and we all think, you know, you and I, that you know, she's just quiet, or she doesn't like to smile a lot, or she's, you know, not very confident,
so they're hiding
not very
nice,
but she's hiding. And by doing 4 simple little veneers, we were able to transform how she thought about herself.
It's a good point. You know, you said something earlier, and I always think that, you know, respectfully, that some of the people on my show are exaggerating, but you say on a job interview, now if this gal were twin sisters,
yes,
the perception is so different with the teeth. It's almost like more sophisticated. And I'm not trying to side with you, by the way. People need to know these are real interviews.
Yeah.
But it is a big difference. Anyway, we're going to take a break in a few minutes. You have time for a few more. What else?
Okay.
Because you have a lot of these.
Yeah,
and these are all on your website as well?
Many of them are on our website, yes. This next one's a guy who came into our office. Looks like an older guy that came in. He had horrible teeth. And quite frankly, the transformation you're going to see when we get to the end, it makes him look 20 years younger. He doesn't even look like the same person anymore. With him, some of his bigger issues, probably what got him to our office, were functional issues as far as he couldn't chew and he couldn't eat properly and he wasn't digesting food properly. He had spaces on one side and spaces on the other, so there weren't really any places where teeth met up correctly where he could chew properly. He thought he was headed for dentures. He was
Did they say that when they come in?
Yeah, he thought for sure he was headed for dentures, and he didn't want to be. In spite of what the first picture looks like, you know, he wasn't that old. He said, "I'm not old enough to have dentures." And I said, "Well, why do we have to have dentures?" And he said, "I just assumed we had to have them." And with him, what we had to do were dental implants, we had gum surgeries, we had orthodontics. In this final picture, this is one of my favorite cases. It really turned out
doesn't even look like the same guy.
It doesn't look like the same guy. And he doesn't feel like the same guy.
It's very interesting. It really doesn't look like the same guy.
It doesn't. I mean, like I said, 20 years. He looks 20 years different.
Younger. So when it's all done, is this the kind of thing that they ever say, "I should have done this years ago"? Or?
Oh yeah, yeah. I mean, obviously, you know, he was one who said, "Gosh, my case probably wouldn't have been this complex had I done this 20 years ago," and it wouldn't have been. However, we're not in the past.
Now, when we back up to this guy's before photo, is this a guy that never smiled?
You know, I think he smiled more than you think.
So for him, it didn't bother him that much.
Right.
Smiling, because he's just a happy guy.
Yeah, he's a happy guy.
But it changed his appearance for sure.
Oh, certainly. Okay, now here's a woman who had always had dental troubles, and you know, we were constantly having to do work on her, whether it be a broken crown or a broken filling or whatever it was. We were always having to do work, and the two of us sat down one day at an appointment and said, you know, let's back up. Let's look at a more comprehensive approach rather than just doing one thing at a time and never getting to where we wanted to go. I knew it was going to be a great case.
Okay.
We looked at her, and she did smile a lot. Even though her teeth weren't what she liked, she was just a happy person. And she went from this level of happiness to this level once we were able to establish a new smile. Look at this after.
Goodness.
She looks younger, she looks healthier, and happier. I mean, quite frankly, I mean, it just brings out all those things in her.
So take me through the process, though. How much say-so? Because I guess one of the fears would be, what is it going to look like, right?
Exactly, and patients.
So how do you determine that?
Yeah, patients aren't dentists, so they have a hard time envisioning what things could look like. So we have lots of these photos. I mean, we have patients who have similar smiles to her or to him. And
you show them on the computer?
We show them on the computer, so it's blown up really big.
Do they ever say, I want that smile?
Oh, all the time. All the time. It's really neat.
Okay.
And then we do we work hand in hand with our lab, and we do what's called a mock-up, where we have an envisioned appearance. We tell our lab what to do, and then we mock it up very similar to that, so they can see it firsthand with a mirror in their hand, what it's going to look like. And they love it, or they say, hey, can we change a little bit? I like them to drive it still.
When it's all done, you say they get emotional sometimes. That means when they see it for the first time.
It's incredible.
Describe that.
We've had, ladies that tear up a little bit, after it's all over. One of my favorites is this guy. He gave me a big high five when we were done. We put the finishing touches on it, and a high five, and you don't see that in the dental office very often. And you certainly didn't see that, in dental schools and so
forth.
Good
So
for you. It's really fun, and it makes our day go really smooth. I mean, it makes everybody happy when doctor's getting a high five, the whole team's getting a high five too.
Now we're just about out of time.
I want to get through a few more if we can.
Couple more.
All right. Here's this case.
Oh boy.
Yeah, before and after. He's not even the same person.
Gee.
Jim's one of my favorite patients too. He's a high school umpire, believe it or not. So he's smiling a lot at opposing managers now when he makes calls and so forth.
Who could take an umpire serious with such a beautiful smile?
Exactly, exactly. And then we had this one. This is a lady who was so fearful of coming to the dentist. She had this huge space between her front teeth. She hadn't been to the dentist in years, didn't want to go, but she had a painful issue, and something came up. And on one of our first times we met, she said, I've always had this huge.
Let me take a look at that.
It's not just a little gap, it's a huge
that's
gap.
Pretty big.
Okay.
So she didn't smile because of it by any chance?
She didn't smile, no. And she didn't want people to see that. She didn't want to go through braces. She didn't even want to be in the dental office. And there are a lot of people out there like that. And we were able to talk to her and talk to her about some of the possibilities that we could do. And we were able to go to this after.
Very nice.
And it's really an incredible case. It was a fun case. It wasn't easy. It wasn't easy on our end because we had to do some things that normally we would try to maybe use braces or something to close that space a little bit, but she didn't want to go through that. Put them side by side and just look at the difference. Look at the difference of her. You can tell her demeanor is different from that first picture to the second picture.
We did say at the top of the show.
Yes.
I said, according to my first guess, small improvements can make a big difference. And this is one of those things.
It is. It really is.
Big difference.
Okay. Here we have somebody who had some cosmetic work done in the past, but didn't like it. She had two ugly crowns, and this goes into some of the materials as far as that goes. The old style, which had metal in those, metal-based crowns, and the light just reflects off of it, and it catches your eye instantly.
So that's the metal you see when you see that line?
It's definitely the metal.
Interesting, okay.
And so the light actually goes through the porcelain, hits the metal, and bounces back at you. And those are the ones you see from 20 yards away, and you go, oh, look at those crowns. Okay. You can see them from that far away. And when we went to an all porcelain veneer and crown on her, we were able to really change her smile. So this young lady came in, she had lots of issues with her teeth, always had, but attached to those teeth are a very beautiful young lady.
So when you see this, what do you see?
When I see it, I see a smile that could be off the charts, and that's the first thing I see, even though the patient may not see that right at first.
Okay.
So with her, we first addressed the gum tissue, and we did a little bit of work there. Then we did veneers, and look at the after. Look at her eyes. That's what pops out in that picture with me. Her whole outlook is different by having that smile.
What a big difference. What does she say? I mean, she must love this,
Oh
obviously.
yeah, and she smiles, and she's another one of our cheerleaders. I mean, she's out there, really helps promote our business.
How many years did she put up with this?
Well, 20 plus years.
So she should have obviously done something.
She could have done something earlier. Yeah.
Good. Good.
So,
is it rewarding for you? I mean, that's an obvious yes question, but
right.
Is that what you like the most?
It's awesome. I mean, to know at the end of the day that you change somebody's outlook on their life by doing something that is bread and butter to us, something that we do all day long, it really changes.
When you went to dental school, you didn't anticipate this kind of stuff?
No, not
like
a chance.
I mean, as far as how you feel and how you make other people feel?
I had no idea that was part of it. I mean, in dental school, you thought you were fixing teeth, and you had no idea you were changing lives.
Good.
So
good. Last one.
Look at this
one
last
more.
case. This is one of the simple cases where this young lady got finished with her braces, and she, quite frankly, just had this gum tissue problem. And we were able to go in with our laser, and in one appointment, this is immediately after this picture that you see. So,
oh, very nice.
But it's immediately after. This took 30 minutes tops. And it was a great procedure. She healed up wonderful, and now she's a college student. She was a high school student at that time. She's a college student, and just loving her smile. And we didn't even touch her teeth.
Very impressive, by the way. And so at the top of the show, you said small improvements can make a big difference.
Mm-hmm.
No doubt about it, you proved that. What do you say to the person, though? They don't like their smile. You say cosmetic dentistry is not for everyone, but if you don't like your smile, do something about it.
Exactly.
Somebody watching this, they're still afraid.
Mm-hmm.
Or maybe they have a tough time doing something nice for themselves.
Right.
What do you say to them?
I have to get their foot in the door. I need them to come and talk to us. We talk to patients all the time, where I like them to be able to trust me, and so that takes sometimes just sitting down and talking for 30 or 40 or 50 minutes, and we just get to know each other, because if you don't know me, it's hard to trust somebody you don't know.
Are the patients getting older and older? They're getting cosmetic?
Yes,
like
definitely.
what? What's the oldest patient you have?
The oldest patient we've done cosmetic work on was in his 70s.
70s.
Yeah.
Interesting.
And he said, "Hey, I've waited a lifetime for this," and he said, "I've put money towards my kids and my spouse and so forth, and now," he said, "now it's my turn."
Okay, good. And nobody's too far gone to get something done?
No, not at all.
Okay, good. I want to thank you for coming to the show.
Hey, thank you for having me. That was
Great
awesome.
info. And we'll have to have you back to talk about what you're doing for people with the CPAP, the sleep apnea.
Oh, I'd love to.
All right.
All right, thanks.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again online, visit our website at wellnesshour.com and just put in Dr. Pyle if you want to show it to a friend. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.